In an ideal world, the easiest way to change, and we're already trying to even incorporate this, I don't want anything to do with the computer in the room. I want to take care of the patient. Okay, so we've had it as far as with it where we have what's called a scribe. Had our nurse come in and she's on the computer typing all of this in, and all I have to do is talk. Okay, that's what I went to school for, not type on a computer. The computer has done both, helped and hindered, because it's very time consuming getting all that data put in. Once it's in, it's much more concise and easy to follow along, easier to find things, not coming in with these big thick paper charts that we used to have before. So at least finding the things is easier, but the hard part is to make sure that you're still going to treat that patient like a patient and not focus on your computer the whole time. So I make a habit of it as far as had rearrangements made in my exam room, so that when I have it on the counter and looking, I'm looking at the patient along with my computer and not off to the side. So from that part of it, you just have to make sure that you keep things straight on that.
I think, you know, medical school, we're really students in medical school, so we've got that part down. But when we go into practice, we kind of put on some different hats and a lot of different roles, I would say. We kind of become more and more detectives and trying to gather all the data and you know, come to the eureka moment where we know the diagnosis. But we also, I think, are increasingly becoming pilots, where we're kind of trying to steer everyone towards health through the complex system, and we rely on teams of people, and we use checklists and kind of guidelines, but then as we get more mature, we are kind of honing our craft and becoming artists, and that's a part that often gets forgotten, where we're you know, artists trying to examine the patient in a way that makes them comfortable, and we're trying to relate their narrative of their condition so that people understand it, and then coming and designing a treatment plan or an operation that'll serve their unique needs. I like the fact that no day's the same, and I never know what I'm going to see. Especially as a hospitalist, you get a lot of different diagnoses coming in, and you never know what the patients are going to talk about, or maybe what their jobs are, or what their experiences are. And so, and then just working with a team of people that all have the same goal of getting them, keeping them healthy.
I am still happy. There are days as far as with it where it struggles, because there's a lot of other obligations, commitments with it. But the part that's still exciting about going to practice is every single day is different. Okay, no two are the same. It can be smooth, can have some catastrophes coming in, never know what's going to roll. You learn to roll with that and go, but like I said, there's never a dull moment.